Breaking news, the House now planning to vote in a matter of hours on the Republican bill to repeal and replace Obamacare. Let's discuss now with Dean Obeidallah, host of Sirius XM, on Sirius XM, and CNN political commentator Matt Lewis. Dean Obeidallah is already doing this as I'm reading the intro, but just so he can stew in his own petard or whatever you want to call it.
That's what I do. Thank you, John.
I'm going to go to you, Matt, because I want to get your reaction now on the House Republicans planning to hold this vote on health care tomorrow. Still a long way to go, but is this the repeal conservatives were looking for?
No, I don't think it's certainly not. In fact, it doesn't really repeal Obamacare, but I think it's a compromise bill. And just today we've seen this Upton Amendment, which would add $8 billion toward the high-risk pool, which would fund people with pre-existing conditions in states that choose or that request a waiver. So $8 billion for 5 years. This is a compromise that moderate Republicans got in order to make this more palatable. But remember, even if this passes the House, it goes to the Senate, it's going to look a lot different if it ever becomes a law.
Well, as I was looking at it, I'm saying, is this, it's kind of like Obamacare. Is this Obamacare light? If you look at if you would look at this special pool sort of as a preconditions thing, Matt?
Yeah, yeah. I mean, I think that, the conservatives ran on the notion of sort of pulling up Obamacare by the roots and having this perfect free market system.
That's not in this bill. And then $8 billion, that's a lot of money. And the whole part of the whole thing was they were spending too much, that we're spending too much money on health care, and now they've added $8 billion to this.
Yeah.
So it doesn't give the savings that they want.
But the idea is that the reason, and the reason that you have the option for states to apply for waivers that would allow them to suspend or the community rating. Okay. In other words, you could charge people more money. That's actually the danger. Somebody who could have a pre-existing condition would have to pay more money if their coverage ever lapses. But the reason you do that is so that you have this high-risk pool with people who have pre-existing conditions so that everybody else is in the main market where there's competition and which would drive down premiums.
Okay,
presumably.
Dean, I know you want to get in. I haven't forgotten about this. But, Matt, then why would a Republican vote for this? Why would they vote for this?
I think that you could argue that on the margins, it's better than Obamacare. There's going to be some more competition.
Is this just about a win? Come on.
I think that's at least half of it, yeah.
All right,
that's at least half of it.
All right. So, Dean, what do you think? You think this is just about a win? Because to me, if you actually look at it, it's Obamacare.
It's far worse than Obamacare. I mean, the CBO, when they scored the original bill, 24 million people.
This one hasn't been scored.
It hasn't been scored. So, but they had to make compromises to get the Freedom Caucus on the far right first for them to come over. This can't provide more coverage. It's less coverage. Most Americans want pre-existing conditions covered. That's something now, that's a given. We should have that. It shouldn't be a question of being high-risk pools. I used to be a lawyer. I did health insurance work representing big insurance companies. These high-risk pools didn't work well. High premiums, the idea of 6 or 12 months of no coverage at all with most of these pools, and the fact very skimpy coverage, high deductibles. It's illusory coverage. People will die. That's my fear. This is not politics.
So it's worse than Obamacare. For you,
it's far worse for the average person.
Hold on. Matt, do you think this is worse than Obamacare?
Look, I would say this. We do not really know. The CBO, as you mentioned, hasn't scored it.
Right.
High-risk pools have worked in some states, like Maine and Alaska. They've failed miserably in other states. We don't know how it's going to go. Again, there was just an amendment today by Fred Upton that adds $8 billion to help fund these.
You're hogging the segment. We talked about that, but I keep calling on you. But then, do you remember? Because I was on the air the night that they passed Obamacare.
Right.
And then I remember the criticism from conservatives of Nancy Pelosi saying, well, you got to pass the bill to know what's in it. That's
ridiculous.
That's exactly what's happening.
Right, and that was ridiculous. And it was come back to haunt the Democrats. 2010 midterm elections, Democrats lost 63 seats in the House.
But isn't that what's happening?
It's part of it, because what you're getting at, and Matt's being honest about it, they want to win. Donald Trump is desperate for a win on a legislative issue. This is going to hurt the Republicans so badly. Democrats only need 24 House seats to take control of the House 2018. This is a gift. This helps them get that much closer to winning the House back in 2018. That's a game changer.
Okay, listen, pre-existing conditions, of course, is the big sticking point, and that's a big debate, really, for most Americans when it comes to health care. And Jimmy Kimmel, of course, We heard the story about his baby, sadly, and then that went viral. Here's what happened on his show the other night.
Before 2014, if you were born with congenital heart disease like my son was, there was a good chance you'd never be able to get health insurance because you had a pre-existing condition. You were born with a pre-existing condition, and if your parents didn't have medical insurance, you might not live long enough to even get denied because of a pre-existing condition. If your baby is going to die, and it doesn't have to, it shouldn't matter how much money you make. I think that's something that, whether you're a Republican or a Democrat or something else, we all agree on that, right?
So, Matt, you've had a lot of explaining to do because you think that this wasn't the right move. I remember when you said it on the air, you came into the room I was in, and everybody kind of beat you up, saying, "What are you thinking? This guy's talking about his child." How much do you think this influenced the conversation, though?
I think definitely influenced the conversation. There's no doubt about it. Look, Jimmy Kimmel his entire premise is wrong. I think it's flawed, but it's an emotional story. As a father of two boys, it hurts me to see him go through what he's going through. And so I think emotion always trumps logic. And so, look, I don't know if it's going to impact the vote tomorrow, which we think is going to happen tomorrow, but I certainly think it does impact the conversation.
So you think emotion trumps logic, so you don't think he should have done it, is what you're saying? You have issues with him doing that?
Well, first of all, I think that he is clearly politicizing this horrible thing. But the problem is,
but in there he said we shouldn't politicize it. He said this is
the opposite, actually, Matt. He said it's not a Democrat or Republican issue. He said this is an issue that should unite all Americans, and he's right. Matt,
all Americans should be united in agreeing with him that Republicans want to kill babies.
He didn't talk about that. He didn't say that, Matt. Matt, if he had said that, that would be a very fair point. Exactly.
Hold on.
He actually said Democrats.
Did you hear him say that, Matt? Come on, be honest.
I think it's very clear. The context here is if you went back before 2014, the kids would have died. Not true, by the way. And the implication, I think, very clearly with the context of this bill being in the news right now is that if Republicans have their way, more kids are going to die.
They could very well die.
His entire premise is flawed. First of all, this bill doesn't do anything about pre-existing conditions. What it does is it allows states to request a waiver that would affect
so if you can't afford, if you're not Jimmy Kimmel and you don't have his money, this is what I heard, and you can't afford to have the surgery and the kind of doctor and the care that he has, that your child would be in a life or death situation, and that no parent, no child, no baby should be put in that situation. Everyone deserves to have quality health care. That's what I heard. Dean, go ahead.
That's exactly what I heard. And one thing to correct, Matt, I'm not sure where you're saying he was wrong. Pre the ACA, children were born with birth defects like a heart problem were denied coverage as a pre-existing condition, even though the child literally did not exist before they were born with that condition. That was actually part of the law. I saw it. I was a lawyer. That's part of the... After the ACA, that no longer existed. You could not do that. You know, there are children who could have died. Yes, you can have Medicaid if you're poor, but what about lower middle class and middle class families who weren't eligible for Medicaid, who didn't have insurance? They have to sell all of their assets and their homes to pay for their kids' medical care, which I'm sure they would do. But is that the country we should go? That's where we should go now? Of course, that's why the ACA's provision on pre-existing conditions is so important. That's why so many Americans, both sides of the aisle, support keeping it, Matt. That's a big thing.
Jimmy Kimmel, the other thing, too, is I would say, not only is Jimmy Kimmel super rich and famous, so this doesn't apply to him, but additionally, he lives in California. I'm pretty sure California is not going to opt out of the current system and request a waiver.
Because he's just rich and famous, it means he doesn't have a heart?
I just think it's a complete non sequitur. I don't understand why he took this very personal thing and tried to politicize it.
I don't think he was politicizing. He was trying to unpoliticize it. I mean, I don't understand how you heard him politicizing. And he said, it doesn't matter which side of the aisle that you're on.
You should agree with him on politics.
He should take the politics out.
Right, he literally said, I think there's something that whether you're a Republican or a Democrat or something else, we can all agree on that. Don't let partisan squabbles divide us on something every decent person wants. He actually was above it. He was actually, and he's not known as a left-wing guy.
That would be like me saying, that would be like me saying, look, whether you're a Republican or a Democrat, I don't do politics, but I think we should all agree that the right to life of the unborn baby is precious.
Can I tell you why you're wrong?
Let me tell you why you're wrong.
Let me tell you why you're wrong, and I don't usually do this. Let me tell you why you're wrong.
Tell me how I'm wrong.
Okay, because all of those people that you hear that these congressmen and these senators are hearing from back home, many of them are Republicans, and they're saying to their congressman, I want pre-existing conditions to say. Many of them are saying, I don't care if it's called Obamacare or Trump care. It doesn't matter to them which side of the aisle. That's why you're wrong. So Republicans,
but the Republican bill doesn't get rid of
who
pre-existing
voted
conditions.
for Donald Trump said, we want to keep the pre-existing conditions in there.
Yeah, but I don't understand why it's an issue that he needs to bring up, because guess what?
Because he has a platform,
the Republican bill
and people
isn't getting
listen
read.
to him, and maybe someone will listen to him outside of Washington where there's so much political and partisan squabbling. Maybe Jimmy Kimmel is the guy who can do it because he's humanizing it. He has a baby that has this condition. If you can't relate to that, you don't.
I've got two kids. I can relate. I think any father can appreciate the pain. I mean, you know, President Obama very famously said, having a child is like having your heart living on the outside in this world. I get it, but guess what? This is a public policy dispute. It's not about emotion.
But Matt,
he's winning the emotional war.
If you came on my show and you talked about your child and you gave a good reason why you believed in something that would help all children through your child and your experience, I would not accuse you. I don't think anyone would accuse you of politicizing it. They would just say that you were speaking from the heart.
We should not make public policy decisions based on the anecdotal story of one famous Hollywood comedian. We should be basing public policy decisions on
How many
logic
Republican politicians use anecdotal evidence of one person I met on the campaign trail who said this to me? This is why we have to have this policy.
Should we base our laws on that?
I don't know why you're continuing to attack subtly, not directly, but subtly Jimmy Kimmel for doing something which was truly, I think, should be applauded. It wasn't Democrat or Republican. One of the rare nonpartisan things in a world that is so hyper-partisan, where we fight left and right on everything. This was a beautiful moment. I would have just let it be, and I'm not sure why you're continuing in a way with this line of attack on Jimmy Kimmel.
You're right. I
don't get that part.
I should just agree that Republicans want to kill babies, and
he didn't say they want to kill babies. Seriously, he didn't say that.
Come on,
Matt.
that's the implication. If you don't look, if you don't
children
let the
will die.
If
the Republican plan passes, children will die. Adults will die. I'm saying that completely bluntly. People will die.
Go ahead and say
if this plan, if pre-existing conditions are no longer covered, 24 million people lose their coverage. Some Americans sadly will die. And if there was ever a chance to file,
and that's not politicizing things. Look, I think we should have civil debates. This is about ideas. First of all, this is a House bill that hasn't even gone to the Senate. It hasn't even passed the House. There was an amendment today to add $8 billion to fund these high-risk pools. This may or may not be a good idea, but you're saying that Republicans want more kids to die.
I'm not saying that. I'm saying, as a matter of fact, they will, Matt. Matt, this should not be political. This is healthcare. There's not taxes. There's not more regulations.
Okay.
These are people's lives.
If I say it, it's political, right? If you say it, it's not. If you say it, or Jimmy Kimmel says it, you're apolitical.
I'm partisan. Jimmy Kimmel is not. I am partisan.
You don't think it's political? You just told me at the beginning of this that half of it was that they wanted to win. That's not political?
No, I think that part of it is Republicans want to pass something. They want to put points on the scoreboard. But what they do not want to do.
Is that the right thing to do when you're talking about health care and life or death situations?
I think that you ought. Additionally, you have to have good policy, right?
Okay.
We haven't even seen
this
CBO
good
report
policy?
on that.
Is this good policy?
I think it's getting better, but look, this thing, I don't even know. We haven't even seen a CBO report on it. We don't know how much it's going to cost.
Do you think they should rush a vote tomorrow?
No, I don't.
Okay.
No, but I also don't think Republicans. Look, here's my point. This is
I got to go, Matt. Seriously, but go ahead. Make your point. No. Make your point. I got to go, but you're going to get the last one.
You have me back another time. We'll continue.
You know, you're never on. I won't have you back.
I can talk for 5 minutes on this.
I'm just telling you, the last time Matt's ever on. Good seeing you, Matt.
Thank you. I've got to get to the next segment. Thank you.